Brenda has one more question here. A year and a half on whole foods, low carb after following your book. Good job, Brenda. Zero CAC score. Party poppers right there. Great. And then carotid artery, US with no significant plaque. Total cholesterol is at 729, as you described. Cardiologist wants to send me to a lipid specialist. Your thoughts?
Yeah, so Brenda also, by her numbers, may be what we call a lean mass hyperresponder. And these are people that go on low carb diets and see their cholesterol levels increase significantly. Figuring out whether or not that applies to you would involve knowing whether or not what your numbers look like before going on a low carb diet. The also is a possibility of what we call familial hypercholesterolemia, meaning that you have a genetic predisposition to high cholesterol. And again, if your numbers were high before going on the diet, that might be the case. The lipid specialist, right, is probably just going to reinforce what you have heard and tell you more reasons why they think your cholesterol needs to be lowered. But trial after trial has shown us that if you have a CAC score of 0 and you are above a certain age, and Brenda didn't say how old she is, but generally above 50 or 60 with a CAC score of 0, there is no benefit to taking cholesterol lowering medications. And again, not personal medical advice there. Find a doctor to work with that you're comfortable with, which may or may not be the lipid specialist. If you were going to go see a lipid specialist, I would ask them, do you know what lean mass hyperresponders are? Do you think I'm one? How do we evaluate that? How do we tell if cholesterol lowering is beneficial for me? Not is cholesterol lowering beneficial in general, right, to a general population? Those are some questions you want to be asking your doctors no matter what situation you're in.